Hello, you are welcome. Today we are discussing community psychiatry. Community psychiatry is saying it's a psychiatric care focusing on detection, prevention, early treatment, and rehabilitation of emotion and behavioral problems as they occur in the community. Community mental health services treat or support people having mental health problems while they continue living in their homes. Institutionalism. So institutionalism, this is a pattern of passive, dependent behavior observed among psychiatric inpatients characterized by hospital attachment and resistance to discharge. So this patient has been attached to the institution and would not feel important for him to be discharged out of the hospital. They are attached to the hospital. That's institutionalism. Then deinstitutionalization, this is the transfer of the patient hospitalized for extended period of time to the community. That's deinstitutionalization. Then you have a severe mental disorder. These are mental illnesses characterized by functional disabilities, for example, inability to do activities of daily living. And you have mental health promotion. So mental health promotion, this is a means of reaching of goals of good mental health through actions that are taken for the purpose of fostering, protecting, and improving mental health. Okay, we come to primary prevention. This is the prevention of psychiatric illnesses rather than treating them. So this involves identifying at-risk groups and then promoting their mental health through education. Secondary prevention, this is the reducing of the numbers of existing mental illnesses through screening, early diagnosis, prompt treatment, and education on signs and symptoms. Remember, in primary prevention, there is a prevention of psychiatric illnesses. And in secondary prevention, there is a reducing the number of existing mental illnesses. Okay, go to the next one, which is tertiary prevention. This is where there are attempts to reduce the severity of mental disorder and its associated disability through rehabilitation activities. This also involves prevention of long-term disability from chronic and persistent severe mental illnesses. Then resilience. This is the bouncing back from life adversities. Okay, so this person, we call them resilient. Someone has been sick for quite some time and they get up, they become well. They say this patient is resilient. Life adversities, they may be financial resilient. So that is what we call resiliency. Concept. This is the way of doing or perceiving something. So what are the signs of institutionalism? Number one, there's dependency. Two, there's lack of initiative. Three, there's inability to solve problems. Five, there's not able to make decisions. if they're not able to live outside mental institution. So these are the signs that this patient has developed institutionalism. The patient depends on the institution. The patient cannot make an initiative, is not able to solve problems. These are the signs of institutionalism. Then if a patient has been disinstitutionalized, okay, so we're talking about the effects of disinstitutionalization. So there will be barriers of social inclusion leading to stigma and prejudice. There will be poor social skills because this patient has stayed a long time in the hospital. Okay, is a community not ready to receive these patients because they believe these patients, they were a problem before they left. So when they come back, they'll continue being the problem. So now the community will not be able to receive this, will not be ready to receive these patients. Some patients may become homeless, have nowhere to stay. All right, so come to aftercare. Aftercare, this is the care that is given to patients who have been discharged to prevent relapse and complications. So to prevent relapse of the mental health conditions. There are types of aftercare centers. They say aftercare homes. They say these are hostels where homeless, mentally ill people are taken upon discharge. Halfway houses. These are communal living situations that provide an orderly way of doing things and support from those recovering from addiction. This is for those who lack family support and who cannot live on their own. So these people, they are given things that they do on routine basis. Okay. Then you have Afro Village System. Afro Village System, this consists of a group of villages where patients can access psychiatric services on a community outreach basis. Okay. Then you have self-help groups. Self-help groups, these are groups organized and led by patients or ex-patients who have learned ways of overcoming or adjusting their difficulties. So these are patients, some of them that they passed through some difficulties and now they have come with a group that will be able to help other patients. So they make a group that they are able to help and adjust to their difficulties. Thank you very much.